Drug addiction can significantly impact an individual's mental health, and many drug addicts may experience co-occurring mental disorders. These co-occurring disorders are often referred to as dual diagnosis or comorbidity. It's important to note that drug addiction can contribute to the development of mental health issues, and mental health problems can also lead to substance abuse. The relationship between substance abuse and mental disorders is complex and can vary from person to person. Here are some common mental disorders that can co-occur with drug addiction. Depression. Substance abuse can both trigger and exacerbate symptoms of depression. Some individuals turn to drugs as a way to self-medicate their depression, but this often leads to a worsening of their mental health. Anxiety disorders. People with anxiety disorders, such as generalized anxiety disorder, social anxiety disorder, or post-traumatic stress disorder, PTSD, may use drugs to self-soothe or escape from their anxiety. However, this often results in a cycle of increased anxiety due to drug use. Bipolar disorder. Substance abuse can complicate the course of bipolar disorder. Drug use can trigger manic or depressive episodes, making it difficult to manage the condition effectively. Schizophrenia. Individuals with schizophrenia are more likely to abuse drugs, which can worsen the symptoms of the disorder. Substance abuse can also make it more challenging to treat and manage schizophrenia. Personality disorders. Some people with personality disorders, such as borderline personality disorder or antisocial personality disorder, may engage in substance abuse as a way to cope with their emotional instability or impulsivity. Attention deficit hyperactivity disorder, ADHD. Individuals with ADHD may be more susceptible to developing substance use disorders. They may use drugs to self-regulate their symptoms, but this can lead to addiction. Eating disorders. Some people with eating disorders may use drugs to control their weight or manage emotional distress related to their condition. Post-traumatic stress disorder, PTSD. PTSD often co-occurs with substance abuse, as individuals may use drugs to cope with the distressing symptoms of PTSD. However, this can exacerbate the condition over time. Obsessive-compulsive disorder, OCD. While less common, individuals with OCD may use substances to alleviate the anxiety and obsessions associated with their condition. Other substance-induced mental health issues. Some drugs can directly induce mental health symptoms. For example, long-term use of stimulants like methamphetamine can lead to symptoms similar to paranoid schizophrenia. It's essential to recognize the connection between drug addiction and mental health disorders and provide integrated treatment that addresses both issues simultaneously. Treatment may involve therapy, counseling, medication, and support groups. Treating both the addiction and the underlying mental health condition is critical for successful recovery. If you or someone you know is struggling with substance abuse and mental health issues, seeking professional help is highly recommended. Certainly, here are some additional mental disorders that can commonly co-occur with drug addiction. Dual diagnosis. Dual diagnosis refers to the co-occurrence of substance use disorder, SUD, with any other mental health disorder. This term encompasses a wide range of possible co-occurring conditions, including those mentioned previously. Dual diagnosis cases are complex and often require specialized treatment. Suicidal ideation and self-harm. Drug addiction can lead to an increased risk of suicidal ideation and self-harm, particularly in cases of severe depression or borderline personality disorder. Substance abuse can impair judgment and impulse control, making individuals more vulnerable to self-destructive behaviors. Sleep disorders. Chronic drug use can disrupt sleep patterns and lead to insomnia or hypersomnia. Individuals with substance abuse issues may experience sleep disturbances even after they stop using drugs, which can negatively affect their mental health. Substance-induced psychotic disorders. Certain drugs, such as hallucinogens and synthetic cannabinoids, can induce acute psychotic symptoms in users. These symptoms can mimic those of schizophrenia and may persist even after drug use has ceased. Cognitive impairment. Long-term drug addiction, especially with substances like methamphetamine or chronic alcohol abuse, can result in cognitive impairment. This can manifest as memory problems, reduced decision-making abilities, and difficulty concentrating. Social and occupational dysfunction. Addiction can lead to social isolation, the loss of employment, and strained relationships. These consequences can contribute to feelings of despair, anxiety, and depression. Personality changes. Prolonged drug use can lead to significant personality changes, making it difficult for individuals to relate to their loved ones and engage in normal social activities. It's important to remember that the specific mental health disorders that co-occur with drug addiction can vary widely depending on the drugs used, the duration and intensity of use, genetics, and individual susceptibility. Effective treatment often involves addressing both the substance abuse and the co-occurring mental health issues simultaneously. If you or someone you know is experiencing these challenges, seeking help from mental health professionals, addiction specialists, or support groups can be crucial for recovery.